Hello. The Community Health Needs Assessment was completed on Charleston, South Carolina by Latoria Garrett. The following information was gathered in a community-based needs assessment that was conducted in, as I said before, Charleston, South Carolina, between the dates of May and June of this year, 2018. This presentation will provide a brief community description of Charleston. It will also discuss the pre-seed proceed methodology that was used to assess the community, as well as information about the physical environment, socioeconomics, demographics about the community. This presentation will also discuss the community health profile, diabetes as the priority health issue, as well as community findings for Charleston, South Carolina, as well as recommendations. The theoretical framework that was used, the pre-seed proceed logic model, was the pre-seed proceed logic model. It's actually a very comprehensive, very popular logic model that can be found in many programs. The model is considered to be one of the most community-oriented and participatory logic models in existence today. This logic model also, like I said, is very participatory, depends on a lot of community involvement from stakeholders. It has two phases, the pre-seed phase and the proceed phase. The pre-seed phase of the logic model is the diagnoses phases, and it looks at things like the social, epidemiology, the behavioral and environmental, the educational, the administrative diagnosis of the community. The proceed phase is considered the action or implementation phase and spells out how to proceed with interventions. So I'll go into some detail about the physical environment of Charleston, South Carolina. The city has a total area of 127 square miles. About 109 square miles is land, and about 18 and a half square miles is covered by water, which is substantial. Charleston has a humid climate with mild winters, hot, humid summers, and significant rainfall all year. The summer is the wettest season in Charleston. About half of the rainfall occur between June and September. So fall is relatively warm, so we have the warm winters and Christmases here. The highest temperature ever recorded in Charleston was 104 degrees, and that was on June 2nd of 85, and the lowest was 7 degrees, and that was back in 1899. I conducted a windshield observation where I drove through the community and just wrote down things that I noticed about the community. One of the things that I noticed was that many of the individuals in the downtown area are poor, like a lot of the pockets of the downtown area are poor. And that's interesting because you have some of the richest and some of the poorest people staying in the same area. There were a lot of water masses and swamp areas all around the community because the land is below sea level. Charleston actually has a tri-county area that consists of Charleston, North Charleston, Summerville counties. Well, and actually Dorchester County as well. So it's Charleston, Berkeley, and Dorchester County. And as of the last census, there were 712,000 people in the area. The median age in Charleston, South Carolina is 34 years old. The median household income is about 57,000 and some change. It's had a steep, it has had a growth of 3.7%. The average poverty rate in Charleston is 16.3%. And the median property value is about $269,000. The participation that occurred in this community needs health assessment was I interviewed two health professionals that actually live in Charleston, South Carolina. I had a quote from one of the people that I interviewed. She said that interestingly, the morale among people that live in the neighborhood is moderate, and many individuals have a welcoming attitude towards health education. She also said the critical needs are health insurance coverage, the development of community-based organizations and clinics that focus on health education and access to healthy foods. I also obtained information from a community health needs assessment that was previously conducted in 2016. The community demographics by population, the comparison of the population by race was about 67% Caucasian people in the Charleston, South Carolina area. Almost 27% were Black or African American. A little over 1% were Asian, and 4% were other, classify themselves as other. The breakdown by age was 25% were 19 or younger. Between the ages of 20 to 34 was about 22%. 35 to 54% consisted of 12.8%, and 55 and older consisted of about 24% of the population. The socioeconomic information that I was able to pull out was it's about 268, a little over 268,000 total households in the Charleston area. The median household income was about 53,000. The average household income was 72,000. And I also got a graph showing the population growth here between the years of 2010 and 2016. Two health problems that I pulled out was that 19% of the residents in Charleston do not have health insurance, and many of them that do, they can't afford to pay their copays. That second health problem that I found in Charleston was many people also have limited access to care, and they go without preventative treatment such as diabetes, mammograms, nutritional and mental health screenings. And this chart just shows the average amount of people in the surrounding counties in comparison to the state of South Carolina that are uninsured, and they have access to care problems. I also did a tri-county and state comparison for the percentage of people that actually receive mammograms, preventative screenings such as diabetes, and you can see that it's a substantial amount of people that does not receive those preventative measures. The priority health issue for South Carolina, for Charleston, South Carolina, is diabetes. This is a chart that shows the prevalence of diagnosed diabetes by race and ethnicity and sex among adults. So you can see the American Indians have the largest amount, followed by the Black and non-Hispanic, followed by the Hispanic people, and then the Asian and the white population. Um, Diabetes testing prevalence in South Carolina. Again, you can see overall it's about 56%, but in females have the highest percent of diabetes prevalence testing. Now, diabetes prevalence in Charleston, South Carolina is higher than that of their counterparts, the surrounding counties, at 11%. I apologize for that. Okay, we can now discuss the findings. The health indicators for Charleston, South Carolina was 19% of people had problems with access to care, 29% go without mammograms, 56% go without diabetes screenings. Mental health affect between 10 to 13% of the population. Obesity, nutrition, and physical activity is 25% of people is obese, and 4 out of 5 adolescents do not get enough exercise in Charleston. The maternal, infant, and child, South Carolina ranks 39th in the overall health of women and children. As I said before, the priority health issue in South Carolina is diabetes. The population groups that are impacted the most are adolescents, people that are 65 and older, people with low to moderate socioeconomic levels, and African American people. The resources that are available here in Charleston, South Carolina, is that the South Carolina Department of Health and Environmental Services came up with a 10-year diabetes initiative and strategic plan to reduce economic and health burdens related to the diabetes epidemic here. The initiative focuses on patient and provider education, as well as elimination of health disparities. Charleston, South Carolina also has clinics that accept patients on a sliding fee scale. Since 19% of the population do not have health insurance and cannot afford copays. The recommendations that I have from doing this study is that cultural diversity diabetes training for healthcare providers need to be increased and done on an annual basis. Free diabetes workshops and educational material should be advertised publicly, let's say on television stations, buses, so you can get the information out about the workshops that are available. And the last recommendation was to add and enforce value-based payment systems like pay for performance for providers, so they can, instead of basing their pay off of how many people that they see, they can actually base it off of the performance and how a person is their health is increasing and their outcomes are increasing. Thank you. And these are my references. Thank you.